I know that this is a challenging time that many are going through right now. And for some, they literally are putting their fertility on hold as many fertility clinics have had to shut down. I wanted you to know that my heart goes out to each and every one of you, and I'm here for any support or questions that you may have. You can email me directly at info@thewholesomelotus.com, and I will answer each and every email that I get. And I'm also offering a free, no strings attached 30-minute consultation. You can find the sign-up link on my website at www.thewholesomelotus.com. Episode number 73 of the Wholesome Fertility Podcast. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist here to provide you with resources on how to create a wholesome approach to your fertility journey. My guest today is Dr. Laura Berman. In addition to her clinical practice, Dr. Berman is an award-winning host of the national syndicated show Uncovered Radio with Dr. Laura Berman. She's been honored with a Gracie Award for Best Talk Show Host and recently was named one of Radio Inc.'s most influential women in radio. Dr. Berman is also a best-selling New York Times author of 8 books and hosted and starred in several television shows, including OWN's In the Bedroom with Dr. Laura Berman, The Dr. Laura Berman Show, and Sexual Healing on Showtime. Dr. Berman is a well-loved and regular expert on love and relationships on television, radio, and written media, and is in the advisory board of the Dr. Oz Show. Dr. Berman was raised in Glynn County, Georgia, and currently lives in Chicago and Los Angeles. She is married and the mother of 3 sons and 2 dogs. So before we begin with this episode, I'd like to give a little bit of a warning that we are going to be talking about some sexual information. And if there are little ones around, you might want to save this for a time that you're alone or with people that are old enough to listen in. So welcome to the podcast, Dr. Berman.
Thank you. It's good to be here.
So can you share your background, how you became one of the leading voices on relationships and intimacy?
How I became a sex and relationship expert?
Yes, everything.
Well, I mean, look, it was not a straight line, except to say that when I set out to be a couples therapist, I very quickly realized that I was an odd one in that couples were presenting sexual issues to me. It wasn't uncomfortable for me, and it was strangely uncomfortable for everyone else around me, including my supervisors and many of my professors. So I kind of created a subspecialty in sex and intimacy by accident out of necessity, because it astounded me that couples therapists are not naturally trained in that and don't necessarily even address it. So that's how I got into this. And then one thing led to another throughout my career.
Yeah, it's actually interesting that you say that because you do have like such a level of comfort in the way you express yourself in your radio show. I kind of like you're just and the fact that you have like just such common sense and you portray it in such an easy and simple way. And once you hear your response, it's like, oh, of course, yeah, that totally
Oh,
makes
thank
sense.
you.
So often couples like, I do, this is a fertility podcast and I'm a fertility acupuncturist. And I often see that couples, because of the whole timing and the stress of conceiving or trying to conceive, they end up getting very stressed out. And sex becomes more of, when
Yeah.
it becomes mechanical, then, the hormones and the cascade of events that happen to prepare for conception don't occur. And I know that also when women orgasm, they actually suck up the sperm and it creates more of an opportunity for conception to occur. So when people, which I'm sure you see all the time, like when people have this external pressure, and it could be really anything, like what do you suggest for couples to get through this external pressure and allow themselves to just enjoy that intimacy in that moment.
Well, all I can tell you is that I don't think I've been around long enough and worked with enough individuals and couples who have had varied degrees of fertility challenges. And I can tell you that I think one of the places where the whole industry of fertility is remiss is that there isn't that common denominator, not failures, but challenges, right? Like it doesn't typically, if you're having fertility challenges, whatever treatment you're doing, it's the exception rather than the rule that it works the first time, right? So what I see happening time and time again is that, when sex becomes wrapped up with something that is challenging, intimidating, frustrating, where there's a sense of failure or shame or insufficiency inside the person or anxiety, then accidentally sex starts to be wrapped up in that. And so what ends up happening is that if you don't interrupt that, it's really common for couples to come out, even with a successful result in terms of a beautiful, healthy baby, but with a real rift between them sexually because sex stopped being about fun, intimacy, connection, play, more tied up in this quest that is so deeply emotional for people and understandably so. So I think it's really a place where the industry is frankly remiss in that most fertility doctors don't even refer unless they feel like the couple's really struggling and one of the members actually mentions it. And I think it really needs to be normalized and a natural part of the treatment process because these kinds of struggles that couples face can definitely be interrupted, wrapped around your entire sex life.
Yeah, I agree 100%. It is such an important part. And there have been some studies that have shown that sperm count and quality increased when there was like true arousal. And it just makes sense because
Yeah.
nature doesn't make mistakes.
No. And you have to give those little spermies a fighting chance. So an orgasm literally
Absolutely.
sucks the semen up into the
Exactly.
uterus and gives them a running start.
Yeah. So should they, when they're in this kind of situation, they get so caught up and stressed. How do
Yeah.
you break apart? I guess go to different places or
Well,
change their
there's lots
environment
of
maybe?
strategies. Change the environment. Make sure you
Mhm.
keep a sexual connection alive beyond the baby making sex. In other
Mhm.
words, not only when you're fertile, not only when it's the right time. Even if you're
Yeah.
saving up sperm, you can do other things sexually that don't include ejaculation. And I don't think in most cases you need to save up sperm the entire time, right? But what the
Mhm.
complaints I hear from couples is that sex becomes something really mechanical. It becomes wrapped up in an extremely um, anxiety producing and sensitive struggle.
Mhm.
It gets self-conscious, it feels forced, those are the sorts of complaints you'll hear. And so I find that keeping your sex life alive and your sexual connection, your sensual connection alive
Mhm.
beyond the baby making kinds of sex is important. Also, really making sure, like, if I could like change this into a law, I would, that every couple who is getting married and every couple who is struggling with infertility, even just starting a simple treatment, should go into 5 to 10 couples counseling sessions with a good couple slash sex therapist. And we would have so many fewer. So, like, what your listeners, if you're going through this, even if you think everything's okay and whatever, go and get that support because the sex therapist will strategize with both of you around keeping the connection strong because you need that not only for a successful pregnancy, but you need that to keep the foundation between the two of you strong so that when that baby comes, you still have a really strong sexual and romantic connection.
That totally makes sense because if anything, having sex is first of all going to make it a little less stressful, enjoyable sex
Yes.
because it's a stress relief and it feels really good to be intimate and connect. Secondly, you won't feel as alone throughout the journey if you're
Right.
connected emotionally. which is another thing. So I'm sure you see this all the time, men processing emotions a lot differently than women.
Yes, of
And
course.
then women sometimes feeling like they're not being understood or,
Right. Or what usually happens is just when something's stressful, loaded, hard, most men, because of the way they're raised and also to some extent just the way their brains are wired, don't want to talk about it. This is
mm-hmm,
even my joke with my husband all the time. Not because, I'm not having kids anymore, but it's not about fertility issues, but whatever it is that's upsetting me or bothering me or something going on with one of our kids or with whatever, I'm going to want to process it a lot. And it comes up a lot for
mm-hmm.
me. And the way that I bond and process it is by talking it out, even if it's already been said. You know what I mean? I may have to
Yeah,
talk it
yeah.
out several times. You know, he would rather not, talk about it. Okay. But like, let's stop thinking, I'd rather just not think about it. If I can't control it or fix it, I don't want to think about it. And if I don't talk about it, I won't have to think about it. Right. And so it is,
Mm-hmm,
it's a really fundamental difference that you have to find a way to kind of meet in the middle around, especially when you're going through a struggle that's as intimate as this. So you have to be able to talk about it. But what can easily happen, and I find that it does tend, to happen more for women than men, is that this becomes the fulcrum of your entire life.
mm-hmm.
And it becomes like an all encompassing thing, and all you want to talk about, all you can think about. And so while you do want to create some space for getting that emotional support with and from your partner, you also want to create a lot of space for fertility free fun and conversations and play and depth and connection. Because
Mm-hmm.
what happens is that it's so easy to make your entire interaction around this struggle.
Yeah, and that happens a lot. And it seems to it's the same kind of thing. I've talked so many times about it, about how like we put everything on hold. Joy gets put on hold, and it's almost like
Yeah.
we can't allow ourselves to have fun until this is
Right.
settled
You're
and
just like,
fixed.
you've pushed the pause button. But what ends up
Mhm.
happening is that a lot of things in your life and in your relationship, especially, can start to fall by the wayside, which then circles back to negatively affect everything, including your fertility struggle. And I love the fact that you provide acupuncture, because you know better than I then that, the anxiety piece, that it's ironically not dissimilar, although I know the stakes are higher when you're talking about creating a life than creating an
Mhm.
orgasm. But when I say to women who are, struggling to achieve orgasm or can't have an orgasm or whatever, is that like the one way to guarantee that you're not going to have an orgasm is to obsess over having an orgasm, because it takes you out of your body. It gets you really self conscious. You're not really in the moment. You're not in the sensations. You're not in your body. You're anxious, which restricts sexual arousal. And, the studies have shown that the more anxious we are about our fertility struggles, the more the fertility struggles are there,
Yeah.
and you hear a million stories like that about the woman who finally decided to adopt or use a surrogate or whatever else, and then gets pregnant once that pressure is off. So anything you can do, and I know that it's hard. I mean, I had my own fertility struggles, not horrific ones, but with my second child, I had to do artificial insemination in several rounds, and I had polycystic ovarian syndrome. And it's
Mhm.
scary and hard not to think about all the time.
Yeah,
And
cuz
so
it
it's,
feels like they want to fix it and kind
yeah.
of get this, yeah.
So things like acupuncture, anything you can do to alleviate anxiety, increase blood flow, increase connection and peace on the inside, definitely helps with ovulation and fertility. Um, as do orgasms, as does a good connection with the person you're trying to get preggers by.
Yeah, definitely. And it's interesting as you were talking about orgasm, it really comes down to trust, kind of leaning into it.
Yeah.
Cuz it's like it's the balance between like or moving from fear to trust, and then you can allow it to happen. It
Mm-hmm.
can't be forced at all. And
Mhm.
so there is kind of like this correlation between orgasm and fertility, kind of in my mind. There's a lot of parallels because
Yeah.
it's all about allowing. And the egg and the sperm to me is such a great metaphor of the egg just allowing the sperm to come in. It's not stressed about it, it just allows it and
Yeah.
kind of trusts that it will come as it should. There hasn't been a lot of studies done on oxytocin and fertility.
Mhm.
There's a lot more studies on oxytocin and pregnancy and birth, and also the bond between
Yes.
mother and child.
Yes.
However, as you know, oxytocin does play a role in orgasms, and
Mhm.
it does play a role in intimacy. So there's got to
Mhm.
be, because just nature doesn't make mistakes. There's
No.
got to be something with oxytocin and the uterine contractions during orgasm and the allowance of the sperm to get sucked in. And so that's why
Yeah, no, I
one of the
think
reasons
that's
why I
true.
wanted to talk about it.
Yeah, oxytocin, we release a huge amount of brains get washed in oxytocin when we have an orgasm, women
Hmm.
especially. And so, if oxytocin does play a role not only in bonding, that's why one night stands, I mean, can be difficult because you accidentally get attached to the person you have good sex with. But
Hmm.
it also can prime the body with those uterine contractions for pregnancy. So pleasurable sex is definitely a good way. It's not the only way. You can certainly get pregnant without pleasure, but it
Hmm.
definitely ups your chances.
What's interesting too is in Chinese medicine, we look at the organs differently. Everything has almost like an energy and a spirit and a connection, a relationship, and the heart is connected to the uterus. There's a heart
Mm-hmm.
uterus connection, and it
Mm-hmm.
comes down to joy and love. And if you think about it, one of the ways for the uterus to open up to conception is through working on the heart and emotions. And what better thing than oxytocin and bonding
Yeah.
to do that?
A woman told me about this book, and I have recommended it to um, a lot of people with, I mean, this was after my childbearing prime, but it's called Spirit Babies. And
Yes. Yeah.
have you heard of this? How to like
I have
communicate
I
with
have,
yourself?
yeah.
Because I think that it's really about creating a different relationship with your fertility journey, and and loosening the grip, which I know like pisses people off so badly. They're like, if
It
one more
does.
person tells me to freaking relax,
Yes.
I'm going to freak out, which I totally get. So
Yeah,
but this to me, looking for ways to communicate with the child you're meant to have and
right.
manifesting that is a way to kind of create some forward momentum and control in a situation where you don't really have much practical control other than around your conception, eggs, and sperm count.
Right. Right. And like again, it's all about trust. It's trusting the process. And I say this so much, so many times that people are probably sick of hearing it. But every single person that I've spoken to, and I interview a lot of people that have gone through their own fertility challenges, they all say the same thing, that during the process and during the grueling challenges that they had to go through, they couldn't see it, but afterwards they wouldn't have changed one thing because they
Right.
ended up with a child that was meant for them.
Exactly. That you're really meant to have. But it's hard to hear that when you're in the middle of it.
Absolutely.
Yeah.
Definitely. And that's why it's important. I think if the husband and wife can connect, and like you said, I think that you bring up such a good point, to have that support through going to a therapist, a couples therapist, a sex therapist, somebody who can actually support the process of and the challenges of fertility, the
Yes.
fertility journey. So it is having that and the place to be able to validate your emotions, I think, is also huge
Yeah, there,
because
and
you need
also
to
to give,
process it.
yes, and to support the two of you in processing it. Because, for instance, if you're, the most common scenario, let's just say, is that you're struggling to get pregnant. She is definitely feeling the pain, the fear, the sadness, the loss when those pregnancies aren't viable. And he is feeling it too, but maybe grew up in a family where emotions weren't supposed to be expressed so overtly, or he feels like I got to keep myself together because only one of us can lose our shit here. And like, if I
Mm-hmm.
lose it too. But when you're in therapy together, it provides that therapy, and the therapist provides some structure and safety for both of you to
Right.
process and to get your and to be honest with each other and with yourselves, and to do that in a loving and supportive way. And so at the very least, you're going to come out of it with really good communication skills that you probably wouldn't have had otherwise. But
Yeah.
usually it's much more than that, and you're supported through keeping a functioning or even developing more of a functioning relationship as a result of, because fertility struggles fall into the category of what I call AFGEs, another freaking growth experience. Like, they
Yeah.
are,
I love
they
that.
really, they really create emotional havoc and break
Mm-hmm.
you open in a lot of ways, especially if you're really struggling and have had multiple failures or incomplete pregnancies or losses. And, it's a huge emotional trauma that can really break you open to a wider, deeper, richer life in the way many difficult times can do if used correctly. And so, since you can't control it anyway, you can only do what you can do. Why not work with it and get the support you need in order to really thrive through it and come out the other end richer versions of yourself, individually and together?
Yeah, absolutely. I agree. And now to another point, what if the couple doesn't have the means to afford couples therapy,
Yeah. Well,
you know?
even if you're doing like walking yourself through, like you have an appointment every week where you're going to sit down and talk about, without blame, how each of you are feeling, and each of you takes 10 minutes and just talks stream of consciousness, while the other person doesn't have to fix it, doesn't have
Mhm.
to say anything, isn't supposed to say anything back, is just gonna, hold your hand or sit next to you and listen and hear you, and then you take turns and you do that, or you but the rest of the time you aren't harping on it and you aren't focusing on it, right? But really taking
Mhm.
that time to build an emotional connection with one another, a sexual connection beyond the baby making sex, and
Mhm.
talk to your doctor, because there's so many therapists that these doctors can refer to that not only take your insurance more so than the fertility program does,
Yeah,
and
that's true.
who also will do sliding scales based on what you
Mhm.
can afford.
Yeah. It's important to make a space, to create a space once a week and just kind of put it on the calendar and make sure that it happens, and then setting a couple of rules
Yeah.
of allowing each other to talk and express themselves. And I think that something as simple as that, once a week we do this, could have such a powerful effect and could alleviate stress, I imagine,
Yeah.
just for the mere fact that they're able to release whatever it is that
Yeah,
they're
the
feeling.
pressure valve a little bit.
Yeah.
And I think also, I actually discovered this with my husband when I was pulling coconut oil. Have you ever done that, where you swish coconut oil in your mouth for like 15
Yes.
minutes? And I
Yes,
couldn't,
it's an Ayurvedic
yeah, right.
technique.
And I couldn't talk during, which is very rare for me because I'm talking nonstop. And so I was sitting next to him and he loved it. He could talk, because I couldn't talk back, and he was talking and stream of consciousness. And then after that, I was like, you know what? Once a week, let's just take 15 minutes where I don't say a word and you just like wax on and la, 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 whatever, and I'll do the same. And it's really, excuse me, it's really powerful, whether you're, have a challenge on the table as a couple or not, just to create that space for each other.
Yeah, such a good point. And I remember listening to your Uncovered Radio talk show,
Uh huh.
and you had talked about dilators and how it's used sometimes for people experiencing trauma, because that actually there is a lot of correlation with that and fertility challenges as well. Um,
With trauma, you mean?
yeah, with
Yeah.
trauma, sexual
Yeah.
trauma, a lot of times
Yeah.
with women, how they feel, how they
Mhm.
allow themselves to orgasm, and
Mhm.
there's tightness in the area.
Yep.
So I thought that was really interesting. So can you talk about what they do and how they can help?
Yeah, I'm a big fan of dilators, whether you've had trauma or just have pain, um, or haven't had sex in a long time and sort of some atrophy there. But dilators are basically like, you know, dildos, for lack of a better term. They're cylindrical. They come in all different forms, but they are the best thing I can kind of use to describe them are those old Russian dolls. You know how one fits in the other, fits in the other, fits in the other
Mhm.
until there's a. So dilators are kind of the same thing. There's this small little thin one that you start with first. So for a woman
Mhm.
with pain or atrophy, she would use some lubricant. She would just practice. Maybe sometimes some women can only get the tip in at first and then the whole
Mhm.
thing, and then just like let it rest there and then maybe move it in and out. And then once you're used to that, after a week or two of trying it once or twice a week, then you do the next size and the next size and the next size. I have a line of aids and devices called Berman Intimate Accessories. But I have a set of dilators that vibrates, which I really like because it kind of loosens up the tissue a little bit more, increases blood
Mhm.
flow and pleasure, and makes it easier. I also, specifically for sexual trauma, um, including women who just want to release past loves, but especially for those who are working with past trauma, I created a sexual healing kit that
Mhm.
has a guided meditation and a healing candle and bath salts and a rose quartz wand. So it's like
I love that.
a crystal wand that you can use externally and internally. And I've had tremendous success with
That's
that.
amazing.
Yeah, that's on my web. All of those things I think are on my website.
And you also talk about yoni silk.
Oh yeah, yoni silk. Now the one thing I'll say, so yoni silk is a lubricant, and this is important. There are lots of lubricants out there on the market, and I think it's really important to say that your genitals, especially women's genitals, are made of mucous membrane, right? The same kind of tissue that's on the inside of your mouth or inside your nose or eyes, and those are like direct lines to your bloodstream.
Mhm.
So they don't go through your stomach or something first. It just goes directly into the blood. So for so many women who, especially going through fertility struggles, and maybe they're not as aroused or they're not as in the mood, or sex has become mechanical, or maybe they just need a lubricant. So because whatever you put there goes directly into the bloodstream, it frustrates me that a lot of women go and buy these lubricants that have all sorts of chemicals in them that you're literally just putting right into your bloodstream. And seems,
Right, and they're horrible for fertility.
yes. Now there are a few lubricants out there that are see that increase the change the pH of the vagina, right? So there's some evidence that the more acidic the vagina is, the less hospitable it is, the more likely the sperm are to die on their way to
Mhm.
the egg. So there are some companies that have come out with like alkaline enhancing lubricants, and obviously you can talk to your doctor about that. I did develop a completely organic lubricant with a base of.
I got cut off with Dr. Berman, so I was asking her about Tantra and then lost the clip. So this is what she said about that. And is a lot of it just connecting before you actually do anything or really prolonging the foreplay?
Those Both of those help, but
Yes.
with most of these techniques, they're things that you practice on your own first, and
Mhm.
then from there you practice it with a partner. But certainly doing things like what I call soul gazing, um,
Mhm. Which is looking at each
yeah,
other.
looking into each other's eyes, synchronizing your breath and your heartbeat, creating a circle of energy, because like the masculine, and it doesn't have to be the man who's more masculine and the woman who's more feminine. It could be either gender, but the one that is more masculine tends to take in energy through in a relationship through their genitals and shares it through their heart. And the one who's in her feminine more will take that energy in through her heart and share it through her genitals, which is no surprise when you think about it, because we are sexually.
Yeah, definitely. I think it would be so good for fertility.
Yeah,
and it would kind of activate things.
It definitely does. And it keeps sex interesting and much more pleasurable, all of which is good for everything, including fertility.
Yeah, it makes you happy too.
Yeah, absolutely.
So yeah, we've had some technical difficulties today, and I don't want to prolong this anymore and have Dr. Berman waiting until everything gets reloaded. So can you talk about how people can find you, what you offer?
Yeah, absolutely. You can listen to my radio show. It's it's syndicated around the country, but even if it doesn't play near you, you can listen to it live streaming or online. It's called Uncovered Radio with Dr. Laura Berman. And I also have a podcast called To Escape for Radio. So you can find all of that, including shop for my products, the lubricant, toys, dilators, all of that on my website, which is drlauraberman.com. And you can follow me. I'm posting daily tips on how to love and be loved better, and sex tips and everything on my social media. So that's on all platforms at Dr. Laura Berman.
Beautiful. I thank you so much for coming on, and thank you for being so patient with my technology today.
No problem. Good luck. Thanks for having me.
Thank you so much.
All right, take care.
So that concludes today's episode. You can find all of the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to share and leave a review. Reviews mean everything to podcasters, and I really enjoy hearing from my listeners. You can also find me on my website at www.thewholesomelotus.com or email me at info@thewholesomelotus.com. I love hearing from my listeners. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com. I thank you so much for listening in and hope that you have a beautiful day.